Up now? Okay. Alright, so let's talk a little bit. Get up and move a little bit. So you guys have probably seen this in and out of the presentation, so this isn't much. Okay? So let's look at this lateral. You get these images. Based off the lateral, are we going forward with assessing this heart?
Yes.
Yes. Somebody tell me why. What did they use first?
The intercostal spaces.
Intercostal spaces. Perfect. How many did you get?
3.
About 4. All right. What else did you guys notice on that lateral?
Increased sternal contact.
Got some increased sternal contact. Okay.
Oh yeah, that's it.
That one is going to be a little tricky, right?
So that they
So that's, remember what's the best way to take a thoracic image?
on inspiration.
Wonderful. A full inspiration, right? Because you want those lungs as aerated as possible to give you that context that you need to see in there and give everything kind of that space that it needs. Good job. See, y'all know more than y'all want to let yourself know. All right. So what else do we see? Lungs turn away. Okay.
That's your best friend.
Yeah. Looking at the lateral. Speak up, baby.
Elevation of the corona.
I'll give that one. Okay. What else? Of the what? No, but we're looking at the carina, so we already had somebody say a little bit dorsally elevated of the carina. That could also be positional. So remember when we're positioning these animals, depending on how we have their heads, so we have them kind of upright like this, like they're sitting up. Sometimes you have like this kink or deviation of the trachea. Sometimes if you have them overextended in the lateral position, you'll have that elevation. So kind of, we'll be mindful about that. Yes, ma'am. Enlarged artery.
I see the
Look now, you cheating. We ain't on that one yet. So find it on your lateral.
No.
Yes. Okay. So she already jumped us over from the other one. So good job, Kim. Thank you. So we see that we have enlarged artery. You can see that we have increased sternal contact. We have lost increased intercostal space. Okay. Yes, ma'am. Have you gone up to the TV to try to look? So, these are going to be the rules of engagement. Before we start, since Kim already has done it, but before we start pointing things out, if you cannot see it just yet, at least attempt to get up and go up to the TV. All right? I'm not going to turn the lights off because y'all already asleep. It's Monday morning. We already heavy eyes. Yes, sir.
So, how do you determine this artery versus the vein, the lateral one? I was assuming it was the vein, but I cannot see that.
Did you get up and look and see where your artery bronchus vein trio are? Okay, everybody go to the TV at least once, please. I can't sit here and just point things out to you. I need you guys to be able to try to look on your own and go up close. Radiology, remember I told you guys it's like that art thing where you got to kind of look at it close, look at it from a distance, look at it close, look at it from a distance.
That's the bronchus right
Say your
there.
question. Let everybody look
That's
because
the
everybody
artery.
probably has the
That's
same
the
question,
vein.
but I need you guys to look at it.
It's that really thin one.
A little bit.
Yes.
And then that's the artery. So you say you're kind of loose.
So then what is this? Is this the air bronchus?
I don't know. A fine line between those. Well, no, it's basically that whole partial
I'm gonna answer everybody's questions at the same time. So just make sure you guys have tried to leave. All right. Has everybody had a chance to get up and look? All right, ready? So on this, Kim pointed to this vessel here. Beneath that is a airway, bronchus. Beneath that is the vein. Tiny. Okay? Another caveat to know is that when we're looking at these laterals, okay, you're looking at, so say my fingers are artery, bronchus, vein for, what is this, right side down. And then these fingers are artery, bronchus, vein for the left side. That vein from the right and the artery from the left are kind of hanging out on top of each other sometimes. Okay? So sometimes we may see something that looks enlarged. So this goes with your question. All right? How do I know that that's the artery? That's why when Kim first saw it on the ventral dorsal, I asked her to point it out on the lateral. While she did that opposite, that's going to be one of those things because subjectively, that vessel looks enlarged. Okay? We're going to support that by seeing if we can see it on the orthogonal view. That's how you'll say. Because you're correct, and I wanted you guys to see this first, that sometimes you may see something that looks big just on the lateral, but the vessels look fine on the ventral dorsal or the dorsal ventral. Okay? That's why it's always good to have two views. All right, you guys see how you guys did that there? So, I'm more confident in saying that's arterial enlargement on the lateral view because I see arterial enlargement on the VD. Yes, ma'am. Come on. Comparing it to the proximal third or fourth rib. Okay? And you're looking at the width of it. If you were to draw a line to measure the width as it compares to the width of the rib. Get to you just a second. I had a question up here. Yes, ma'am.
So I'm like not seeing it. So this is the artery. So what is that radial you said?
That's another artery there. So remember I said there's going to be artery, bronchus, vein, and then artery, bronchus, vein. So if we just saw this image by itself, it may be questionable on whether or not that's arterial enlargement. But because we have its orthogonal view, and we can confidently say that that's an enlarged artery, then I'm more confident in calling that an enlarged cranial artery.
So you said this was an artery, bronchus, and this is.
So remember you have a left and a right side, okay? Artery, bronchus, vein. When they sit on top of each other, they sit kind of like this. Artery, bronchus in between, vein, artery, bronchus, and vein, they superimpose from the opposite sides. Okay. So say that's the left side. Okay. So when you're looking at this, remember you're looking at two sides of a body laid on top of each other, correct?
Yes.
Okay? They're not going to technically be just symmetrical and laid on directly on top of each other. You're going to see vessels from the left side and the right side coursing to the cranial lobes. Okay? So when we look at a thoracic image, we have it split up in cranial lobes, cranial lung lobes, caudal lung lobes, correct? Y'all should have had that first year and second year. Then, when we talk about how we visualize the vessels, remember I said it's going to be hard to really differentiate which vessels are what and the caudal. So when we're dealing with laterals, we are assessing the cranial lobar vessels. Okay? Cranial lobar vessels start with artery, bronchus, vein from one side. Then the other side starts artery, bronchus, vein. Okay? There's going to be a vein and an artery superimposed on each other from the opposite sides. Okay? Now, we raised a good question. Well, how do we know that that's artery based off of this image alone? Well, we don't. We just know that it's subjectively large. If you guys look at the width of that and look at his proximal 1, 2, 3, 4th rib, It's just a tad smidget larger, okay? I can confirm this finding by looking at the orthogonal view, which is why we say always take more than one view. You guys remember that? Okay? So because, and this is where Kim pointed it out the first time, she saw this vessel here. We call that the artery. We see this on this view. I can say that this is arterial enlargement on this view, because I have something to support that finding. Yes, ma'am?
Is that dog laying on its tail in the ventral dorsal view?
Is it laying on its tail?
Yeah. You see the spinal cord, and if you move cranially, it gets smaller and smaller, and it looks like a tail in the
No.
right side. This. See this? And that tip right there is the tip of the tail.
No. Why would you tail that long back?
I mean, then what is this? I don't understand.
All right. So let's think about that.
Why would it be? Why would it
anatomically?
narrow if it's the esophagus?
A tail one can anatomically go that far up, but what you're looking at here is just the vertebral column.
No,
Okay,
that's not it.
that's all the bones there. You're looking at the ribs kind of course into the sternum. That's what you're seeing here. This soft tissue
Yes.
structure that's coursing out
Yeah.
here,
Yeah.
that is a combination of the mediastinum, a combination of the descending aorta, and all of that stuff that lives on midline.
Okay.
Okay?
Okay.
All right. Everybody understand this lateral view now? Okay? Now, you guys have a nice clock up front. Looking at the clock analogy, where do you see these bulges? Two to three?
1 at 4 o'clock.
Y'all can speak up. I want to hear some enthusiasm. Act like y'all want to be here. If not, we can give an assignment.
No, 2 o'clock.
That's worth some points towards class.
2 o'clock.
I see it at 4. Yeah.
2 to 3.
Okay. I need to hear some enthusiasm, some interaction, because I'm not just sitting up here. I want to make sure you guys are solid before we start talking about the diseases.
2 to 3, 3 to 6.
All right. So if we have 12 up here on midline, 1,
2.
y'all said 2?
2 to 3.
Y'all said 2 to what?
2 to 4. Some
Well,
people say 2, some people say
I would
3
say
to
3 to
6.
6.
Somebody said 3 to 6.
Or 2
Somebody
to
said
6.
2 to 4.
Why can't it
Hold
be?
that side. You're throwing all of it, right?
1 to 6.
Oh, okay, right. All right, but everybody can at least appreciate, excuse me. You guys can appreciate the bulge kind of coming from here, right? Without necessarily giving an exact time zone, we can appreciate that bulge. Now, you guys are looking at this area here, right? It looks like a little teddy bear belly. That's what y'all think? It looks like a teddy bear belly, like if you get a gummy bear, it has like a little belly.
Nah, that's
Yeah,
look like a
appreciate
bucket
that.
top. When you describe it.
Come on now.
We're not giving
They
it
have
to
a little belly. Okay. I was trying to compare it to the little teddy bear belly.
That's a bucket top.
Alright.
You gotta build it.
So this is where we start getting into those troubles, and we're going to start getting more practice in that, because when we look at left ventricle versus right ventricle enlargement, we sometimes get this false sense of ventricular enlargement. All right, so there's actually more of a bulge on the right side that's pushing that outward. Okay, you guys see it kind of rounded off a little bit? Let me point it out from the computer. They're like, man, Dr. Carter. So we're looking at this area. Oh, shoot. Looking at this area here, kind of bulging out. And then you guys see this. But this is really where that bulge is kind of pushing this laterally. You guys see this area? It's kind of hugging and pushing this outward. Maybe. Possibly. Just go with me for right now.
Okay.
Okay.
That's what we
Just go with me for right now. All right. So with this one, you guys said loss of cranial cardiac waist, increased sternal contact. This one we have arterial enlargement. We have a bulge here, okay? So bulge in this area, we're looking at somewhere around the main pulmonary artery. If we get a little bit lower, we're thinking left atrium. Then if we're looking here, say this is a real bulge, right? We're gonna think left ventricular. This one that I'm trying to point out will more than likely be right ventricular, okay? That would also support our loss of cranial cardiac waste and kind of have impact on that increased sternal contact, okay? So when we're looking at these, we're not necessarily trying to make a disease fit, but we're gonna list all of our findings that we see and see which ones correlate, okay? Which ones are correlating with that of left-sided enlargement, which ones are correlating with that of right-sided enlargement. So, somebody over here asked me if this was elevation of the carina, okay? Don't shoot. I'm gonna get your name. I know your faces. So, after I list all my findings, I'm gonna see, is there anything else that signifies left atrial or left-sided enlargement? And I'm gonna make sure that I correlate that to make my differentials make sense to my findings, okay? So you always wanna start with your findings, then you wanna tie them together, you connect your dots, okay? So this is kind of like your little puzzle here, and you wanna make sure everything kind of makes sense. Because you don't wanna just say, oh, it's arterial enlargement with a whole bunch of left-sided things, okay? Right? Because left-sided, if we remember blood flow, what would we expect to be big if it's left-sided disease? What comes out the left side, what comes out the right side in the cardiovascular area? In the chest. Let me ask that a little bit better. So when we're entering the heart, we're entering via veins. So we got the cauda vena cava coming into the right atrium, down into the right ventricle, out the what? Main pulmonary artery. Okay, so when it's circulating through the pulmonary tissue, it comes out the heart as arteries. Remember, everything exiting the heart is arteries. When it comes back into the heart, it's entering through the veins. Okay, and then we go to the aorta, right? Y'all got that? Okay, so if I'm exiting the right side of the heart through arteries, the main pulmonary artery, and I have disease there, I would expect the arterial side to be enlarged. Okay? If the veins, which are coming into the left side, are enlarged, I expect some disease going on the left side of the heart. Correct? All right. So you guys see how it's important? Again, this funky phrase, we got to know our anatomy, and I made us go through the blood flow. Yes, ma'am. Radio opacity. Okay. So, what do you think it is? Give me your best shot.
The vessel.
Which vessel? You guys are smarter than you want to let yourself believe. You guys know a lot of this radiology stuff, and you guys are being shy. Let it out. All right, so point it out to me. So that line there. Okay. So, can everybody see me? I'm going to go back to the computer, but I'm going to stand right here. Which opacity do you think this is? What part of the body? Good job. Okay, I'm going to repeat. Y'all heard him? On this side? Spine of the scapula. That side. Spine of the scapula. Okay? You guys see these opacities coming straight down. Remember, that's because he's sitting like this. Alright? So, we just need to sign up on midline You should see this tubular opacity that is the trachea.
Wait.
Going down like this. Hold on, let's go to the computer.
On the right side, she said?
On both sides.
The trachea?
No, she's talking about the spine of the scapula.
Yeah.
Okay.
Oh.
So, spines of the scapula, here and here. If we follow from here, we're looking at the trachea. And then here is where it bifurcates, okay? And that's what you're seeing. There's certain areas, sometimes you can see, if I was able to play with the contrast and like the levels, you can sometimes see it course upwards to the cranial lobes, just like that. Or sometimes you can see it going to the right middle. All right, but this going down is a trachea, and then it bifurcates. This area is actually important because what lives in between there, remember I said left atrium sits on midline? Also, it's your mediastinal lymph nodes, okay? And then some of those pulmonary vessels coming out the heart, okay? Yes, ma'am.
Could you point to where it bifurcates one more time?
Right in here. And then it comes down. Around. Yes, ma'am.
Okay, so that's the trachea. What's the other tubular radial?
Oh, so that gets a little funkier, right? So you guys gotta put on, remember this is a bunch of shades of gray? And it's a play on lights. And we look at these things, right? So this area is actually just the left lung lobe, but you're seeing a difference or wanting to see a difference because you have the mediastinal region here, which consists of the aorta and other mediastinal tissues. You have this spine, so it makes it seem like you're demarcating the area, when in actuality you're not.